Hello, everyone. Good morning, good evening, good afternoon, depending on where you may be in the world. And thank you for joining us again for an NDD live training. Today, we are going to be talking about the EasyOne Air portable spirometer. If you happen to have a different NDD device, be sure to check back over on our website to see. We cycle through a different product every month to just see when the next time the product that your facility owns will come available. But again, today we're going to talk about the air and we're going to go ahead and get started. Right. All right, so in this training, we are going to talk about the basics of spirometry, starting from how to enter the patient data into the spirometer, how to successfully coach a patient through a spirometry maneuver. We're going to focus on just the FVC, the expiration only maneuver today. We're going to talk about how to interpret the quality messages that are coming from our spirometers to us. A little bit of tips and tricks on reporting some results, and then we will end the last 10 minutes or so of the presentation with a live Q&A session. Be sure to type your questions over in the bar at any time. On your GoToWebinar dashboard, there is a place for questions. Be sure to type those in. Bianca's on with me today, and she'll be answering those as we go along, but then also pull some of those questions out at the end. I just want to make sure you guys know if I don't get to your question live on the air, I do get to see it in my report once the webinar is wrapped up. So we will get that, we'll get your questions answered either way. All right. One other thing I wanted to bring up is you guys do get a recording of this in your email tomorrow. So anyone who registers for the webinar, whether you attend or don't attend, you do get a copy of the webinar in your email tomorrow. And if you are watching this recording tomorrow, thank you again for taking the time out of your day to go through it. All right. So I am going to stop sharing my screen here for just a moment. And I'm going to talk a little bit about the EasyOne Air spirometer. And you'll have to excuse me for just a second. GoTo has rearranged my things just a little bit. There we go. So I was missing my camera view here for just a second. But talking about the EasyOne Air spirometer. So all of NDD spirometers use a point-to-point ultrasound to measure flow. We know spirometry really is just a flow measurement. We're measuring how much air a patient can move in and out of their lungs, and we're also measuring how fast they can move that air in and out of their lungs. Spirometry by itself doesn't give us an overall diagnosis. You know, we have to use other tests, patient history, to make that formal diagnosis. But spirometry can tell us if a patient is normal, if they have an airflow restriction or an airflow obstruction. So that's really what we're going to be focusing on today. The EasyOne Air spirometer, like all of our spirometers, uses a point-to-point ultrasound. It uses a single patient use mouthpiece, which is the flow tube for this device. Even for our expiratory only maneuvers, we do recommend patient nose clips because we want to make sure that we're capturing all of the volume from our patient through the spirometer. And then if your facility does require the use of an inline filter, you have the EasyOne Filter FT for the flow tube connection that can be added to your device as well. All right, I am going to go ahead and share my screen back over to my demonstration software for the EasyOne Air. So let me make sure that this is going to show up here. All right, so you should be seeing a screen, a little purple screen that does look a lot like our EasyOne Air once we power it on. The power button is a hard key on the top of your spirometer. And once it powers on, you will see a screen that looks identical to the one that I'm showing you as a screen share here. You'll see that there are 5 primary tiles on the home screen. You do have access to the full device manual here on the screen. I am connected to my EasyOne Connect software via Bluetooth, so that is showing. And then my battery status over on the upper right-hand side. Our preferred test type is going to be front and center, the largest tile on the home screen. Additional tests that the device can perform will be in that more tile. Our reports, those are going to list, again, this is demonstration software, so there's not real tests on it, but our reports are going to put our reports from our device in the most recent, so chronological order, with starting with the test most recently performed last on this device, listed first. Underneath the Patients tab, we can add a new patient. We can delete a patient from the device. This will hold about 10,000 tests. But if you do need to remove a patient off of the device for any reason, you can delete them. You can edit them if something was entered incorrectly the first time, or if you need to, let's see, sorry, I lost my train of thought for just a second, but if you need to edit a patient that's already been entered in the spirometer, whether it's been a change, so they've lost weight, gained weight, their height has changed, especially if you're dealing in pediatrics, you're editing your patients pretty much every time you see them. And then also if there's been something that was entered in error, because we know that we have this criteria for our predicted values. So how do we determine a patient is normal? And those are dependent on some of that patient information. So if there was an error, let's say we put their height in wrong, their birth year in wrong, that is going to affect the way that the device is reading our results. So if we do need to edit, we also have the option to then recalculate that test to the correct patient demographics. All right, but first, we're going to spend just a little bit of time here in the Tools menu. Before we get too far, I do want to tell you guys, we know that this is a standalone spirometer. This spirometer, you can do all of the settings on the device itself. You can have a printer directly hooked to the base for the EasyOne Air, and this device never needs to interact with the computer. However, to see the graphs a little bit bigger, to access any of the animated incentives in EasyOne Connect, or to have access to some more advanced reporting features, the device would need to be synced with that EasyOne Connect software. So I'm going to bounce back and forth just a little bit so that you can see what both of those options look like, both of as a completely standalone device and then also syncing with the EasyOne Connect software as well. All right, so I'm going to go ahead and click on Tools. Remember, when I'm making adjustments in the EasyOne Air, this is making adjustments to the device as it's a standalone device. All right, I'm going to go ahead and click on the Settings tab. And I'm going to start here in the Device tab. So this is where our system language, the time and date settings, the time and date format, how are we measuring our values? Are we looking in metric? Are we looking in imperial? And then one thing that is missing from my demonstration software is if you are using the EasyOne Filter FT for your tests, this is also where you would check to turn on that filter setting so that the device asks us before every single test, are you using a filter or are you not? So that is just missing from my demonstration software, but it is located in this device tile. All right. So you'll see there's some other things that are device specific. How loud is the speaker volume? Do the keys click when you touch them? The screen brightness, and then how long the screensaver will pop on when the device is left unattended. All right. Scooting back, I'm going to now go underneath the Print tab. Underneath the Print tab, again, this is applying to if you are printing directly from your EasyOne Air spirometer. If you are syncing to the EasyOne Connect software to save as a PDF, to directly interact with an EMR, or to print more advanced features from the software, these print settings are not the ones that you are going to adjust. You'll actually adjust those in EasyOne Connect. So when we're adjusting printer settings on the Air itself, that is when we dock it, and this is hooked directly to a printer to print that report. All right, you'll see that an external printer is selected, the US letter format, the data selection. I have the default is to show the 3 best trials, the 3 best curves, and to also show both the flow volume loop and the volume time curve. I also have, if you are occupational health, if you're research, if you are a person that is required to do a calibration verification, there is also a place where you can check mark to have that last calibration check show on your reports. All right. The areas that are the header 1, 2, 3, 4 here, again, that is your letterhead. So if you want it to say, you know, St. Mary's Hospital in Indianapolis with your address and your phone number on your reports, this would be, again, where you would come in and enter that when you are printing directly from the Air device. All right, and the last 2 are just margin settings. All right. Popping back to that settings menu, last but not least, we're going to talk about this spirometry tab. This is where all of the settings that are specific to spirometry are located. So which spirometry standard are we using? We still do have the 2005 standard available on our devices, just for some occupational health has not moved over yet. And then also for research studies that were ongoing, have previous data in 2005. So we do have that still available. However, today we're really going to be teaching that 2019 standard and everything that goes with that. On the preferred test type, again, this is whatever you want to be that biggest tile on your homepage. So the test that you do the most. Below this, where it says to beep during the maneuver, that is an auditory incentive for your patient, that they can hear when the patient first starts to blast through the spirometer. The beeps are really, really, really fast, and then they get slower and slower and slower as the patient gets closer to that point of plateau where no more air is coming out of their lungs. So again, I do recommend having that on. Below that, we have our predicted value sets. Again, my demonstration software is not up to date like it is on my EasyOne Air device. So I still have GLI 2012 selected. We do have the new GLI 2020, the global GLI on our most up-to-date software version. I do not have a pediatric value selected just because GLI does go down to age 4. And then for my system interpretation, there are several options, but I do have the Gold Hardy selected. Below this, just a few other housekeeping things. The patient ID format, some facilities have alphanumerical, some are numbers only. The graph that we want to see when we're doing the test, again, I do recommend being able to see both graphs, the flow volume loop and the volume time curve. And then also to show the predicted range. So where should the patient go, so that we have a visual of what that patient, based on their patient demographics, what their values should be, and then what they are actually performing for us. All right, there's some other additional ethnic corrections down at the bottom that can be customized. But again, we kind of go with the predicted value sets that are available, and you'll see that there are, many different predicted value sets. Most of those are, specific to a certain geographic location. All right, so I'm going to go ahead and hit the home button and come back over here. Again, I did say I'm going to switch back and forth just a little bit. If there's anybody on the call that had used the previous model, the EasyOne Plus, there's a couple of things. We do get asked this question quite a bit. You can Bluetooth this to your computer, both for testing, live testing with the EasyOne Connect software, and also for data management. You can also be connected with a micro USB through your EasyOne dock here. So one to a printer, one or to a computer with a USB, and then the other is the power cord. All right, but one thing that this device will not do, just because of the capabilities of the port, you cannot connect via USB and then do the live testing with the EasyOne Connect software, which is a difference from the older Plus device. We do get that question a lot, so I always like to try to answer that when I can. So you can live test with Bluetooth, but not with the USB connection. All right. So the next thing that we need to understand is what type of patient information do we need to enter so that the spirometer knows what is normal for this patient and what is not. So I'm going to go ahead. There's two different ways on the EasyOne Air that we can enter a patient. So when we click on the test, the first thing it's going to ask us is, who are we testing? So you can either add a patient or select a patient from the list. Or like you guys saw earlier, we can click on the patient tab and we can click to add a new patient. Either way, whatever works best for your workflow. So it's going to walk us through these first 8 screens. So it's going to ask us for our first name, the last name. And if you're a research customer who is completely anonymizing your patients, something has to be entered in this first name, last name tab. And then you can use, of course, the patient's study participant ID instead of their MRN number. But your study normally will have specific things that it wants you to put in that first name, last name slot. All right, there's their patient ID. I'm just going to make something up. Date of birth. Sex at birth. Height in feet and inches, unless you have specified centimeters in the settings. And then the weight in pounds or in kilos, whether you have done that in the settings, all right? Even if you are using the global GLI or the race neutral GLI, our software does require you to enter something for ethnicity, even if you are using something that does not factor in the ethnicity of your patient. If you're using that, of course, you can put their actual ethnicity, or other is always an option as well. And I'm going to click on finish. It's telling me that I have very similar patients in this database, which is true. It's going to give us another chance to kind of come down and review the information that we have entered. And you'll see that there's also some additional fields down here in the at the bottom of this screen. So has the patient ever been diagnosed with asthma? Is the patient a smoker? If so, how many cigarettes per day, how many smoke years, and has the patient ever been diagnosed with COPD? Again, these are just extra fields. It just gives us more information on that spirometry report about what our patient is doing. These don't figure into the predicteds in any way as for what is normal for this patient and what is not, but it is good data to have on the spirometry report. Right, so I'm going to go ahead and click OK. And I'm going to go back out to the home screen. So now you'll see that that brand new patient that I just added is there and ready to test. All right, I'm going to stop sharing my screen here for just a second and talk a little bit about what you need for the test. So we kind of went through a little bit of this earlier. You will obviously need your EasyOne Air spirometer. Even with the exhalation only maneuvers, we do recommend patient nose clips just to ensure that we're getting all of the volume through the spirometer. We'll need our flow tube mouthpiece. And then if your facility requires that EasyOne filter FT that fits directly onto the end of the mouthpiece. All right. On the top of your spirometer, you will notice that there is a stamped arrow. This one, I normally have these, I normally kind of color these in before the webinar so that you can see them easier, but this one you can actually see pretty well that there is a stamped arrow on the top of our mouthpiece as well. So the mouthpiece will only go all the way in one way, and we want to make sure that those arrows are pointing towards one another. Sorry, it's a little bit difficult to see on the mouthpiece. If you happen to have the mouthpiece inserted incorrectly or not pushed all of the way in, it is going to give you an error to check the flow tube insertion. So if you happen to get it in the wrong direction, it is going to have you correct that prior to the test. If you are using the EasyOne filter FT, you'll notice that this is not a perfect rectangle. It's a little bit bigger on the top than it is on the bottom. And that's the same for your filter connection, so that it just slides all the way on one direction. Always just make sure when you do slip that distal filter on that you didn't pop the mouthpiece out the other way, because that again will result in that testing error. So if you're testing with the inline filter, it is on the side away from the patient. All right, so we have all of our supplies, we're ready to go. Let's talk a little bit about preparing our patients for spirometry. So spirometry is not an easy test. And I always kind of lead in, not only when I'm teaching people to administer the test, but when I'm talking to patients as well, letting them understand that this is not an easy test. No one ever breathes like this normally. We don't breathe like this at the grocery store or taking a walk. This really is something that we have to teach our patients and understand what is expected from this test. We have to explain to them that we have to do this test a minimum of 3 times where the results are acceptable, and they're also reproducible, meaning one trial looks like the next, looks like the next. We need them to understand that it is difficult, that it might wear them out, especially if they have a pre-existing lung condition. I'm asthmatic. On days that I do spirometry all day long, I'm struggling by the end of the day because even though I know how to do it correctly, it is a really, really tough test for some patients to perform. It takes a lot of encouragement from us. The PFT lab's kind of the loudest place in the hospital. You constantly hear them yelling to, keep going, blow harder. But that type of encouragement really does help our patients understand the forcefulness that's required of this maneuver. We are eliciting a very specific behavior out of our patient so that we can see if there is an issue, an obstruction, a restriction in their airflow. So if they're not doing it correctly for us, it's really, really hard for us to place any value on the results we receive. So I feel like sometimes setting the stage for our patients really does help them understand when they know going into it, it's going to be difficult and I have to do it the way you're telling me to do it, or it's not going to help me. It's not going to get me that diagnosis that I need and that treatment that I need faster. All right. So again, we have to do it 3 times. We're going to talk about here in a minute what makes an acceptable spirometry test, what makes a reproducible spirometry test. I get this question every time we do live training. If your facility does tidal breathing or normal breathing prior to the spirometry maneuver, that's perfect. You can choose to do tidal breathing on this device by selecting the tidal breathing option. I personally do not teach tidal breathing when I teach basic spirometry, just because it's one more step and one more opportunity for us to desynchronize with our patient and for them to have some confusion. So the way that I will teach this is to do the entire maneuver right from the start on the mouthpiece. We always get the question, well, what if I have them take their big deep breath, then put the mouthpiece in, then blow? That's fine. If you're not getting a hesitation error, continue to do it that way. Or I feel much more comfortable when I have the patient breathe normally first. Perfect. You keep doing that, whatever works for you. There's not right or wrong. We're not getting data from that tidal breathing, but I know that some physicians have a preference to see it on their reports, and that's totally fine, which is why we have the option in the EasyOne Air to do those tests with tidal breathing. All right. So a few things to think about with your patients. Sometimes we know if they're going to get a spirometry test, if they give us, the red flag words, they're short of breath, they've been short of breath, they're a smoker, they have a cough, all of those things that kind of trigger in our brains, they might need a spirometry test while they're here. Not every patient knows. Sometimes it comes up during the visit and the nurse, the medical assistant, the respiratory therapist thinks, while they're here, let's go ahead and get spirometry. Your physician might have specific guidelines. So not smoked for X amount of time prior to the test, no fast acting inhalers, X amount of time prior to the test, no long acting inhalers, X amount of time before the test. And those are things that can vary from provider to provider based on their preference. Another thing, spirometry is pretty safe. I mean, there's not a lot of huge risk from spirometry. We always want to have them seated in a stationary chair, or if they're more comfortable standing, make sure that that stationary chair is right behind them. We are asking them to push out this air as hard, as fast as they can. So there's always a little bit of a risk that our patients will have a vagal maneuver while doing the test. While that's pretty uncommon, what we are asking them to do, it's definitely something that we should be prepared for. Pregnant women can do this test. Lots of anybody, even really, really sick patients can do this test correctly. Their results might not be great, but they can still do the test correctly. Things that we can't see, abdominal binders. If your patient just had major abdominal surgery or head surgery, probably not the test that is safe for them. If they are wearing chest binders, girdles, suspenders, tight shapewear, ladies, we need to, I guess, and gentlemen, we should be able to take a big, big deep breath in and blast it out as hard and as fast as we can. So anything that they are wearing on top or underneath their clothes that will make that more difficult for them, we want to make sure that that is removed prior to testing. Again, I do recommend nose clips for every patient, even on an expiratory only maneuver, because sometimes patients are sneaky. They try to sneak breaths in through their nose, or they leak through their nose, and we're not capturing all of that volume that we should be through the spirometer. Another question that I always get is about dentures. A patient with well-fitted, secured dentures can make a much better seal on this mouthpiece than if their dentures were removed. However, on the flip side, if your patient has loose dentures that are ill-fitted, we don't want them to end up with the spirometer on the other side of your lab. So of course, take those out if they cannot properly make a good tight seal on the mouthpiece. All right. I a lot of times also get the question about oxygen. What about our patients that use home oxygen? As long as, and again, this always talk to your provider about what their safeguards are in this situation. For myself as a respiratory therapist, if the patient can maintain their saturation above 90 off of their oxygen, they can do the test without their oxygen. Obviously, if they cannot maintain a room air sat of 90 for a prolonged matter of, a matter of time, we probably need to be doing the test with their oxygen on, okay? But again, that's stuff that you can talk with your providers to build into your facility-specific protocol on how to prepare these patients for the test. All right. All right, we kind of get to get into the more fun stuff now. We get to look at kind of what the test actually looks like. I'm going to do a few tests on my spirometer here, and then I am going to Bluetooth connect to the EasyOne Connect software, excuse me, so that you can see what the test looks like there as well. All right, but for the most part in this training, we're going to treat this like we're using it as a standalone device. All right, so let me go ahead and share my screen again here. And again, I apologize. GoTo has done a little bit of an update, so things aren't where I think they are. So I apologize that it's taking me just a minute to click around here. All right, you should see the box back up. Again, I'm not sure exactly what the view looks like right now. I kind of have it trying not to cover my face, but my view is a little bit different this time than what I'm used to. So again, we can go straight to our test tab. We can add the patient if we have not added them yet, or if they are a patient that's already in our system, we can select them. And then we kind of have one last chance to double and triple check that all of the information we added for our patient is correct. Because again, our birthday, our sex at birth, our height, and our ethnicity, depending on what predictive value set you're using, all figure into what is normal for this patient. So we really do want to make sure we have accurate day of information. So day of weight, day of height, all of that the day of their visit. All right. As soon as we verify that everything is correct, we would click to start the test. And again, this is demonstration software. So if I click start test, it's going to give me a strange error and tell me that I'm not actually connected to my device. So I am going to go ahead and stop sharing my screen for just a moment. And again, forgive a little bit of the movie magic here. I'm going to try to get the spirometer in a good position so that you can see the screen during the test. If not, don't worry. I have some screenshots and some pictures that we can look at after. So for the instruction to our patients, after we go through the entire spiel that we discussed earlier about what is expected of the test, I do recommend that you as a provider have a mouthpiece that you can demonstrate the test for the patient. A lot of people are very visual learners. Just giving them the instructions sometimes doesn't sink in. So actually showing them how to do it on your own mouthpiece is really, really a useful tool to help them understand what's expected sooner. But once we're told, we're going to hand this over to the patient. Again, it does have, I always call this like the Wii strap, like the Nintendo Wii strap, so it doesn't fly across your lab. We'll have the patient loop it around their hands, both hands on either side of the grip. We're going to have them make a good tight seal on the top and the bottom of the mouthpiece with their teeth on top, tongue on bottom. We don't want them to bite too far down on the mouthpiece, and also make sure that their tongue is not blocking it as well. So we want to make that good tight seal immediately, take a big deep breath in, and then blast it out as hard and as fast as we can. We're going to have the patient keep blowing and keep blowing and keep blowing until there is no more air coming out of their lungs. If you're doing the exhalation only maneuver, it's going to stop the maneuver as soon as that point of expiratory plateau has been reached and take you over to the results screen. If you are doing an FVL maneuver or the full flow volume loop, once you hit that expiratory plateau, the device will tell you to take a second deep breath in to end the test automatically. All right. So again, I'm just going to show you an example of a couple of tests. The first thing it's going to ask us to do is to block the flow tube. Again, I'm always fighting a glare, guys, so hopefully I can get it where you can see it. It's asking me to block the flow tube so that the ultrasound sensor can do a quick baseline setting. Basically, we just want no air moving through the mouthpiece while it does this quick self-check. We can leave the plastic on the front. If you're using a filter, your filter kind of does it for you, or you can use a gloved hand to the front or the back. On this device, I normally use a gloved thumb and just cover the bottom. And I will click OK. And then very quickly, we'll hear an auditory cue. There are happy beeps. You'll hear me say that quite a bit. And the coaching bar is telling us to have the patient blast out. So good tight seal in the mouthpiece, big breath in, blast it out. All right. And since I have my headphones on, I don't know that you guys are hearing the beeps. Hopefully, maybe they're coming through my microphone just a little bit. But at the end of a good trial, you'll get those same happy beeps, the upward beeps. If the trial was not good, or if it's one that's being thrown out, the beep is much sadder. I don't know how else to describe it. I always say it's happy beeps and really sad beeps. But between each trial, you are going to get coaching feedback from the device. Mine right now is saying good effort, do next. And it's also giving me these overall session quality of both the FEV1, so how much air I got out in the first second, and the FVC, how much air I got out overall. We're going to talk a little bit about acceptability for each individual trial versus the session overall here in just a moment. I'm going to do one more demonstration before we do that though. So I have two different options. It's asking me to add another trial or to view the data. So we can view the data at any time. I have some screen grabs that make that view a lot easier that I'll show you here in just a moment. So I'm going to click on add trial. It's going to give me those happy beeps. Sorry, I'm hoping you guys can hear them a little bit. And it's telling me to have the patient blast out. So good tight seal on the mouthpiece, big breath in, blast it out as hard and as fast as you can. Keep going, keep going, keep going until the device tells you to stop. All right, I got those happy beeps again. It's telling me good effort, do next. So let's take a little bit of a look at what that screen looks like a little bit more closely. So I'm going to pop back over to my slides. All right. So this is a little bit of what those screens look like. So you'll notice with the 2019 standards, we kind of changed the way that we look at our data. In 2005, we looked at the test overall, assigned it a letter grade like in school, and moved on. With the 2019, yes, we are still assigning a letter grade like school to the overall session quality, but now we're also looking at each individual trial and indicating that it is acceptable, usable, or not usable. And we have displayed this by using these stoplight smileys. So like you can see on the green screen, that indicates that both that FEV1, how much air we got out in the first second, and the FVC, how much air we got out overall, both of those are acceptable. They meet the acceptability criteria we're going to talk about here in just a moment. The yellow smiley, this one is very, very common, and we'll talk about a couple examples why here in a moment. At least one of the parameters are usable. Both are at least usable, but they're both not acceptable. The most common example of this is when your patient, they're going to feel like they are out of air before they are actually out of air. As long as this is beeping and until the trial ends, the spirometer is still registering flow through that mouthpiece. We're not doing it to be mean. There is still air coming out of that patient's lungs until the device stops sensing it. We get about 80% of our total lung volume in that type of maneuver out in that first second. So if an average person takes about 6 seconds to completely empty their lungs forcefully, that is 5 very long seconds squeaking out the last 20% of our lung volume. So yes, we are going to dump those huge big airways first, and then we're going to be squeezing out the rest of the air until we make it to that point of expiratory plateau. And our patients feel that. So the most common yellow smiley is we have an amazing FEV1. We blast out hard and fast immediately. But once we start to feel like we're running out of air, we end the trial prematurely and we don't make it all the way to expiratory plateau. So we would have a green smiley face with FEV1 and a yellow for the FVC because we didn't make it all the way back down to baseline. So that is, again, the most common example of that yellow smiley. And then obviously the red smiley, at least one of those parameters, FEV1 or FVC, is not usable at all. If anything happens in the curve prior to that 1 second mark where the FEV1 is recorded, it's going to throw that whole trial out. If there was a leak, if the patient coughed, if they swallowed, all of those things prior to 1 second, it's going to give you a red and throw the whole thing out. All right. So when we choose to click on that data screen in between each of our trials, it brings us to this screen. all right, that you see displayed here in the PowerPoint. If we click on that smiley face, it's going to bring us to this very, very detailed pass-fail criteria. Why did we get the smiley face that we got? Again, it's the same if you've seen the demonstration on the EasyOne Connect software. We can still access all of that information on the EasyOne Air. It's just located in a little bit different place. All right. So it's going to give us that acceptability criteria, and it's going to give us the coaching to help them through the next maneuver. All right. Like I said, we look at each individual trial as acceptable, usable, or not usable, and then we look at the entire test session overall and assign it with a letter grade. So this is looking at the entire test. So we know that we have to have a minimum of 3 acceptable reproducible trials to get that letter A grade. And this chart is actually straight from the ATS ERS spirometry standard. This is not NDD's really cool grading system. This is actually straight from the standard and how spirometry should be graded. So in order to get that letter A grade, we have to have 3 or more acceptable maneuvers that for adults are within 0.15 liters of one another. So one looks like the next, looks like the next. On the next part, if you were to click on your session quality on the Air screen itself, it will actually give you a pretty good breakdown of what that looks like, the variability between your trials and then your quality letter grade. All right. So when we look at the report, again, this is the report that is coming straight off of the EasyOne Air device. Again, if you have a custom report or have custom report needs and are printing through EasyOne Connect software, your report might look a little bit different from this one. However, this is reporting to the 2019 standards. Actual values are shown first, followed by the patient's lower limits of normal based on their predicted values. Their Z-score, so a deviation off of normal based off of those predicted values. And then lastly, their predicted value is last after this, okay? The Z-score and the Z-score graph are now also displayed on the report. 2019 and the 2022 ATS interpretation really puts a lot of focus on Z-score to interpret that disease severity. So we want to make sure that we're following that standard. All right, you'll also see that this is displayed on that on the EasyOne Air report as well. All right, so we talked a little bit about what makes it repeatable, but we've kind of just said, they have to be acceptable maneuvers. But what exactly does that mean? We kind of start with the most complicated one, at least on paper, that is, and that is we want to make sure that the patient has an explosive start. They are blasting out as hard and as fast as they can from point zero, from the zero axis. So making sure that there's no hesitation and that FVC, or excuse me, the FEV1, how much we get out in the first second, really comes from the maximal effort from our patient, okay? Our BEV, or our back extrapolated volume, should be less than 5% of that FVC. That just means we want to make sure that we are blasting out as hard and as fast as we can from the start of the test. And again, this is one of the big reasons why I don't do tidal breathing and why I really do have my patient do their inhale and their exhale on the mouthpiece, just to minimize the chance of this hesitation error popping up. All right, so what else defines an acceptable maneuver? We want to make sure, again, that we don't have a glottic closure or an abrupt stop. So we really want to make sure that we don't have this within the first second, because then we're going to have a red, sad face on our reports. If it happens after the first second, again, that would send us to a yellow because our blast out was great. After that is when we stopped. Glottic closure, 9 times out of 10, is your patient's posture. Sometimes the first thing a patient does when we tell them to blast out as hard and as fast as they can is they wad themselves up in a ball and put their chin to their chest, completely closing off their airway. Of course, there are some anatomical things that maybe could cause this. Another thing that can cause abrupt stop is when they shove their tongue in the mouthpiece, which does happen quite a bit. So on both of your graphs, if you see your volume time abruptly flatten or your volume or flow volume curve abruptly drop down, something abruptly stopped the flow into the mouthpiece. Something caused it to stop, whether that is posture, them actually closing off their airway, whether it's a tongue, whatever that is, just making sure that we are reiterating to our patient, this is one big blast, teeth on top, tongue underneath, nothing blocking the mouthpiece. We can also watch their posture during the test to make sure that they're sitting up nice and straight with their chin off of their chest. A cough. So we cannot have a cough before that 1 second mark, okay? That affects everything. If we have a cough after the first second, the software can recover from this cough. As you can see in this example, that cough happened about 2.5 seconds. That patient continued to blast out all the way down to baseline. A lot of times, though, it's really, really difficult for our patients to recover. Just like, when you start coughing, it's really hard to stop. So we want to make sure that if our patients can't continue, don't make them continue. You can either delete the curve or leave it. It's not going to be included in one of the 3 best anyway. Give your patient a drink, allow them a couple seconds to catch their breath, and then try again. Again, a cough before the first second absolutely will throw out the whole test. A cough after, while the device can recover, your patient might not be able to. And last but not least, here's where those nose clips come into play. Our patients think that they're sneaky. We tell them that this is one solid breath out, one solid blast out with no extra breaths. Once a person starts to feel like they are out of air, they will sometimes try to sneak in extra breaths. Like when you would do the breath hold game when you were a little kid and you would like try to sneak breaths through your nose so you'd win. I don't know, maybe I just did that. But that's what these patients will try to do because they're starting to feel out of breath. You're screaming at them to keep going. So they feel like sneaking those breaths either around the sides of their mouth or through their nose is going to make us happy. It doesn't. That's not what we need from them. But you'll see the extra breaths, just like in the example here, very, very clearly defined. Again, if it happens before 1 second, it's going to throw the whole test out anyway. If it happens after, that's just more air they have to blast out to get to baseline. Stop the trial. Explain to them again that it is 1 breath in, 1 breath out. And if you're not utilizing nose clips, make sure that they have nose clips on. All right. We talked about this just a little bit when we looked at those letter grades, but again, that's what makes the trial acceptable. What makes a trial repeatable is that when the difference between the 2 largest FVC or FV1 values is less than or equal to 0.15 liters. Okay, this is not something you have to remember. Thankfully, the software records the variability for us. All right, I'm going to stop sharing that for just a second and hop quickly over to EasyOne Connect. So EasyOne Connect is our PC software. This is for when and I'm sorry, my screen is doing weird things again. There we go. This is if you are, again, you can utilize this for data management. If all you're doing at the end is syncing your device to EasyOne Connect to access advanced reporting features, to sync to an EMR, to save a PDF file, all you have to do is if you're connected via Bluetooth, you can hit the icon down in the lower corner. It will sync that device to your computer. Or if you are connected via that micro USB and your dock, when you put it on the dock and put it to home screen, it's going to download those patients from your device. All right, I am going to quickly show you guys what a test looks like here. If you were to Bluetooth your device, which give me just a second, it's trying to find my PC. So let me get it over here, finding my Air device. All right. So I'm just going to do a quick trial on here so that you can see what it looks like on the big screen. All right, it's asking me, am I using a filter with my EasyOne Air? Sorry, now it's synchronizing. Hang on. All right. All right, it was mad at me because I unplugged my EasyOne PC. So give me just a second here and I'll reshare EasyOne Connect. There it is. All right, I'm going to select myself as a patient and pop over to my test. I might. My Bluetooth might be acting up today. And if it is, we won't waste a lot of time on it. All right, it looks like my Bluetooth doesn't want to cooperate. So what I'm going to do is I'm going to pull up a test. All right, so let's say this was a test that just synced over from your EasyOne Connect device. If you are utilizing the software only for printing, still trying to find it. Sorry, the Bluetooth is not happy with me right now. Now it is. Let's just see if it'll let me do this. All right, it is happy now, so I guess we will give this a shot. All right, I'll just do one trial for you guys just so that you can see it. Good tight seal, teeth on top, tongue on bottom, big breath in, blast out. All right, the Bluetooth on my Air is acting a little bit finicky today, so I again apologize. Let me pull you up really quickly here. Want a good test. There's one. All right, from here, again, whether we do the test Bluetooth to the software like I just did, or whether we are syncing the device just to be able to access the tests on our computer, I'm going to go to report. And it's going to pull up our spirometry report. All right, on the PC software, we do have several different layouts that you can choose from. If you're an occupational health customer, we have a custom NIOSH report that's available to download on our website that you can utilize. You can print to a network or an office printer, any printer that is on network with your PC. Or if you are saving as a PDF, you can do that here as well, save as a PDF. Or if you have a custom EMR solution where these are being sent back and forth, that would be done here in the EasyOne Connect software as well. All right, so I'm going to stop sharing that for just a moment. I am going to pull up my last test. All right, and do a quick test for you guys. All right, so I am adding a trial to the test that I had already performed on this device earlier. So this should be my third green trial. All right, I got those happy beeps and it is telling me that the session is complete so that I can go ahead and end the test. Once I end the test, again, it will bring me to this screen that shows all of my, all of my best values. If I want to see them all, I can click on that table to expand it. All right, there's my normal spirometry. If I were to click on that, it's going to give me some details. There's a box where we can enter comments. And then also that session quality button. If I press that, it's giving me the variability between my largest FEV1 FVCs and giving me that overall session quality grade. All right. From this screen, we can take it to our dock and hit the print button. If this dock is directly connected to a printer, it will send that automatically. Or we can click finish. And if this is connected to our computer, once we're back at the home screen, we can dock it and sync it to our software. All right. So a few different ways that we can use this device, which is really, really nice. But a little bit of a different flow depending on how your office is using that device. All right, we have right about 10 minutes left. I'm going to go ahead. I've seen the hand go up several times over here, so I know that Bianca's probably been answering questions as we've been moving along. But of course, we want to try to answer a few more of those on here, because if one person's thinking it, probably somebody else online is thinking it as well. So Bianca, are you there with us today?
I am, Jamie. Thank you so much. So we've had a few questions come in regarding the software and
Okay.
and asking about the charge. So I'll let you answer that.
The charge, can you,
The cost of the software.
gotcha. All right. So the EasyOne Connect software is actually included with the purchase of the EasyOne Air device with a little bit of information. So the serial number of your device, some identifiers from your facility. You can download that software directly from our website. Um, the cost, again, the cost of that is free for the life of the device. All the updates on that EasyOne Connect software, all you have to do is go and download and install the updates from our website. So you really can, if you have an Air and want to see what it looks like with the software, you can download that from nddmed.com at any time.
Perfect. Thank you. So a few more are coming in here. Someone is asking, do you enter patient data directly on the spirometer, or can you use a laptop and Bluetooth to type in the data?
So that is one nice thing about Bluetoothing to the software. I mean, we're all pretty versatile with our thumbs these days, entering the patient data on the device itself. But if you are testing via Bluetooth to the software, you can, excuse me, you can enter the patient demographics and the patient information into that EasyOne Connect software, and then use the Air as a remote testing spirometer. Again, if you're using if you're printing directly from the Air, if you're not interacting with a computer, you are typing on the actual Air screen.
Perfect. Awesome. Thank you. Um, a few other questions. Let me just kind of go through these. Somebody is asking about the tidal breathing option,
Okay.
where that
Um,
tidal breathing option is.
yes, let me pull this little guy back up here. So you'll notice underneath the more tests that you don't really see it there. So in order to get that tidal breathing test, it has to be selected as your preferred test type. I apologize, I'm getting a little tongue-tied. So if we go back into tools, we go back to settings, we go back to spirometry. Underneath preferred test type, you'll see that there's the tidal FVC and the tidal FVL. So yes, so if you were clicking around and you saw there's not a tidal breathing option on my more screen, if you're tidal breathing, it has to be set as your default test type. All right, there we go. Oh, I think I X'd out of that. Maybe I might need it again. Sorry, go ahead.
All right, Jamie, that might have been it.
All
I think we've
right,
answered all the questions.
you guys were quick today. Well, as I mentioned earlier, you will get a recording of this webinar tomorrow. If you have specific questions, please reach out to me. I know sometimes we can get a little situational in the chat, and sometimes we don't read those online if you have something that's very, very specific question for your facility. But we're happy to answer those. Our support team is available on live chat, on the phone, on email at support@nddmed.com. We're always happy to answer your questions. If your facility needs more in-depth training, feel free to reach out. You know, our sales reps do a lot of facility training. We also do have an e-learning platform that we love customers to be a part of that really does walk through spirometry basics all the way through the buttonology of the whichever NDT device you've purchased. So there's lots of different options out there to make sure that you and your technicians are 100% comfortable performing the tests on whichever device you might have. All right. Next month, we're going to be cycling over to the EasyOne Pro, talking about the DLCO test. But just keep an eye on our website. You know, we do cycle through all of our different products from month to month. We are also this year doing a couple of other really, really neat we're doing a technology series this year where we're looking at all of the different and kind of unique applications where our technology is being used in research. We're also going to have some expert panelists come on with us this year to talk about the difficulties with spirometry, interpretation of spirometry, just kind of trying to give a wide variety of content to every one of you guys that tune into these live trainings every month. So we really do appreciate your attendance and your questions because they really do help out everyone. All right. Well, have a fantastic weekend. Have a wonderful time. We will be back on again next month with the EasyOne Pro, and we will see you again soon for another NDD webinar. Have a great day.